little bit about female sex drive. There are some new diagnoses that doctors use, but it really just comes down to a lack of libido or lack of sex drive. We've got hypoactive sexual disorder, meaning that you're not having as much of a libido as we would expect or as other women. There's female sexual arousal disorder. These are just labels. We've talked about labels before. What's the real problem here? It's not that you have a disease that takes away your libido. What happens is, for some reason, either hormonal imbalance or some other physical reasons, you don't have the sex drive. Or maybe you have the sex drive and you can't enjoy sex because of pain or other problems. So what can you do? If you're a little bit anemic, that can affect sex drive. Other things in your blood chemistry can indicate certain disorders or problems in the body that are going to affect you. Remember, you have to be really healthy to have a healthy sex life. If you're prone to diabetes or if you're pre-diabetic, that's definitely going to affect your ability to enjoy sex as a female or as a male. If you smoke, you're going to be affecting circulation, you're going to be affecting blood flow. So there are certain things you have to do in taking care of yourself so that you can enjoy sex to its fullest extent. Alcoholism, drug abuse, a lot of medications that women use can directly affect sexual desire. Again, we want to talk about whether or not women have the desire for sex, but also if they can enjoy sex physically, because many physical problems affect your enjoyment of sex. It has to be comfortable. It has to be something that arouses you. There is a real component of enjoyment to sex. It shouldn't just be a mechanical performance. There's something doctors refer to as post-baby coolness or postpartum depression. There are many different labels for it. It is true that your sex drive is going to be much less after you've delivered a baby, but for most women it does return not long after giving birth. If you're finding that it doesn't return, there are things that you can do, even some behavioral therapy that can help. Certain prescription drugs, especially tranquilizers, can definitely affect sexual drive in a female. Also, a lot of the antidepressant drugs, especially the SSRIs, directly affect hormones and neurotransmitters in a way that's going to lower sex drive. It'll also make it so a woman cannot get aroused as easily, as quickly, and have as much fulfillment in sex as she might have if her body was working correctly. Certain drugs, such as antipsychotics and some of the antidepressants, can stop a woman from actually reaching orgasm. Now, most women are capable of getting to orgasm if they're healthy, but there are certain drugs and even certain things in foods that can stop you from reaching orgasm, and it's a biological process that the body has been interrupted in. Many times women have hormonal abnormalities. You can have